From challenges to champions, we are here talking about sickle cell disease. What it is that we don't know about it, the research behind it, why is it affecting the African American community at large, and what is the hope for the future? And I'm excited to be sitting next to me, Dr. Kim Whitley, and you are the medical global chief medical affairs officer for patient advocacy and external collaboration advisor with Pfizer. That was such a long title, but I want to make sure I did not mess it up.
Thank you. Thank you. So wonderful for you to have us here to discuss this very important topic. Thank you.
Absolutely. So when I was just doing a little bit of research, I had to also first start with my family because I have family members who carry the trait. And I was thinking, well, what is it that I really know about sickle cell? And the only thing I remember is my grandma saying, if you carry the trait, make sure you don't marry somebody that also has the trait. It was little things like that. And I know that it was very prevalent in African American community, but there still is so much that we don't know about it, even research that has not been done in this area. I always like to start out, why is this not just about research, but why is this personal to you? What is your personal story?
Sickle cell disease is a rare condition here in the U.S., but it's the most common blood disorder worldwide. And the sickle gene became prevalent in communities of color because our ancestors lived in environments where malaria was prevalent. And sickle cell trait provides protection from severe complications of malaria. So it meant that those individuals were surviving longer and then having children. Sickle cell disease, though, is another story when we think about symptoms and complications. Although many individuals with sickle cell trait may never know that they have sickle cell trait because they never have symptoms, those with sickle cell disease develop complications early in life. And in fact, those complications can be as simple as hemolytic anemia, as complicated as unpredictable pain, and as devastating as end organ damage that decreases survival in the sickle cell community. So I'm so glad you asked that question of why this is personal to me, because in my medical training, I became aware very early that those living with sickle cell disease were not treated the same way, did not have access to the high quality of care that they deserve. It's limited resources for research. It's limited our ability to take care of individuals with sickle cell disease so they can lead a symptom-free life.
I'm so glad you brought all that up, and I just wanted to go over just a few statistics. I was mad at myself because I was like, I should have known more than what I absolutely knew. But it was saying that it affects 1 in 365 African American births, and the disparities exist at large quantities and leading to, like you were saying, lower quality care, more hospitalizations, and shorter life expectancies, and that individuals with this disease have a life expectancy to 40 to 60 years. But does it have to be that way? What is being done? So in terms of what Pfizer is doing on this behalf, what are you doing to kind of overcome these challenges?
One of the things that I think that I've learned throughout my career is the best way to make a meaningful difference about the visibility of sickle cell disease is to let the sickle cell warriors tell their story. And hearing these statistics from a healthcare provider like me doesn't compare to hearing the story through the words of somebody that lives it every day. The stigma associated with sickle cell disease when you have to go to the emergency room because of pain and be classified as being drug seeking, or being ostracized by a classmate in school because their eyes are yellow, individuals with sickle cell disease, because of the breakdown of red cells, when people think that that's indicative of an infectious disease, which is not the case. So all of these stigma that individuals with sickle cell disease have to overcome could be very much eliminated by awareness and education. So I think that that is why we have not made a meaningful difference in survival, because there's still such stigma, such poor access to high quality care, so few therapies that are available for individuals with sickle cell disease, because this is a marginalized community that's been overlooked for decades.
Okay, so I just really want to get, when I hear you talk, I keep saying, why? And like, can we just bring out the racial component that is in this? Like, I cannot have this conversation without saying that there is underlying racism through this. This is something that affects the Black community at large. So when we're talking about a lack of resources, training, and even transitioning from childhood to adult care is a major issue. And every time I'm hearing this, I'm like, racism, right?
You're exactly right. And it's sad that sickle cell disease, in order to get research funding, it had to be a political agenda in 1972. And then literally within the last 5 years, the National Academies of Science, Engineering, and Medicine had to commission a team to address this. And their recommendation was that sickle cell disease be classified as a health disparity because of the structural racism and stigma that this community has experienced.
You know, when you talk about these issues, you just have to take a long pause, because it's a lot of quiet things that are going on in my head that I'm just like, what is really going on? But I want to, more from your experience as a pediatric hematologist, what stands out to you about caring for patients that the next generation of care providers really need to know about?
One of the things that I think is an opportunity for a career that is focused on trying to find better ways of caring for individuals with sickle cell disease is that we haven't raised awareness from young people that want to be doctors, nurses, nurse practitioners, social workers, community health workers. We haven't raised sickle cell to show the health disparity that it is and how individuals can make a meaningful difference by devoting their careers in research and clinical care to this community. I think that one of the things that is so striking to me is how much the sickle cell community gives back despite what they've been through. They are still trying to bring attention to their condition, to try to get individuals interested in finding better therapies and addressing more respectful, compassionate care for this population.
Let's talk about that. I just want to, as we transition and end, what is the hope that you see? And I'm looking at you, and I'm just excited to see a Black woman in this position, and I think it helps even people with this population, because automatically off the bat, it feels like, okay, I feel like you care, like you really understand, like you see me. And I think that's a part of a lot of issues that we deal with, even in healthcare. Do you see me? I just did a panel on maternal and infant care. And one of the biggest things is I don't feel seen. So what is the hope that you see in this position that you have with Pfizer in this field?
I think this is a unique opportunity to raise the sickle cell warrior voice, to bring awareness and visibility to the complications associated with sickle cell, the need for new therapies, the need to advocate for increased access to high quality care. Sickle cell disease should be a condition that you can live with symptom-free. And really that's my goal in my career, is to make sure that we can provide opportunities through healthcare for those with sickle cell disease that would allow them to do whatever they would have wanted to do with their lives if they were not born with this condition.
Thank you so much, Doctor, for giving us this information, and also in this conversation, showing and letting us know how we can even advocate for ourselves. I think that's a big part of it. People not understanding, well, how do I advocate? How do I make my voice heard? And as family members and communities, how we support them and everything. So thank you so much.
Thank you, Ebony, for bringing attention to this community and the well-deserved improvement in healthcare that they really, truly deserve.
Absolutely. From challenges to champions. That's what we're talking about today.